Namaste, viewers, and welcome to this special episode on Be Consciously Healthy with Dr. Maria Scunziano Singh. Thank you so much, Dr. Maria, for joining us. And it's a very happy occasion for us viewers because Dr. Maria has just become the Fellow of Integrative Medicine, and it's a very important certification. It's awarded by the American Board of Physician Specialists, the American Board of Integrative Medicine, you see. And before I ask you, Dr. Maria, what exactly this means, for our viewers, I want to emphasize how you are certainly the most titled and qualified physician in our entire area. So let me just start by, MD is, of course, where you began in New York, and then you, I think, were at the Sloan Hospital there, or was it? Yes?
Right.
Exactly. And then ABIM, NMD, diploma ABLM, and ABOIM. So that is such an amazing, impressive, astonishing track record. And I mean, we are very proud of you. And I also must say that our entire community, our patients especially, are so fortunate to have someone like you in our area, because I think it's going to help them tremendously. But just to focus on your newest certification, please tell us what it is, how you got it, and then we'll actually go on to try and understand what integrative medicine is. And viewers, I only want to say one thing. If you think it's some kind of strange stuff, alternative therapeutics, no. It is evidence-based. It is holistic, as we've been saying all these episodes in the past. And before I hand it back to you, Dr. Maria, I just want to say, a standard disclaimer: this is not medical advice, and please consult your doctor before you make any changes in what you're doing with your health. So, Dr. Maria, please tell us how you got this certification. You must have had to study so hard. What was the didactics like and the whole procedure?
Well, thank you, Professor Ranjape. It's my pleasure and honor to be here talking to everyone about the subject of integrative medicine. I was invited into the Center for Integrative Medicine, the Andrew Weil specifically. Dr. Andrew Weil, basically pioneered a lot of integrative medicine in this country, and the Andrew Weil Center for Integrative Medicine is part of the University of Arizona. So it's a site that I had to travel to a number of times from Florida. I was happy to have been invited. They, I guess, heard about me and my work that I do in holistic care, and that was a couple of years ago. I had a 2-year program to complete, the fellowship program, specifically focusing on all the elements of integrative, which is that you are putting conventional work, conventional medicine training, that is that which I got my MD in, and that would be specifically for treating a lot of disease and pharmaceuticals and various other tools that are not exactly nature born or made. These are more a mechanistic, more mechanical type of things, synthetic products in the conventional sense, as opposed to a more non-conventional, which would involve a lot of other tools, more natural approaches, that is using botanicals, that is herbs and plant medicine that gets incorporated into that. Other tools which are ancient, these are ancient tools which we're taught in the integrative course, in the integrative fellowship course. We're taught about ancient traditional ways and means of treating disease and or preventing disease. The approaches carried down through the millennia we get into, and the most recent, refined, if you will, type of ancient stuff is taught. So we use things like botanicals. We talk about acupuncture. We learn acupuncture principles. We learn auricular acupuncture, which is that which involves the ear. The ear is a representative of the entire being. Your entire body is represented on your ear. And so while it's not a full acupuncture course, that is incorporated. We learn Ayurvedic principles, which are really stemming from the Indian subcontinent and all of those things that have been used and carried down through the ages. Different types of hands-on therapies, different types of natural herbs and oils and so forth that are used. Different breathing mechanisms, breath work, yoga, so on. So there's a lot that goes with the Eastern teachings. Traditional Chinese medicine, which is now, by the way, called East Asian medicine, for inclusion of not only China, but all of the Asian countries that have contributed to the treatment of and or prevention of disease. They all contribute. So Japan, for instance, Korea, Indonesia, Nepal. I mean, there are different places that they've contributed. So it's put in a broader category called East Asian. And so traditional Chinese medicine is still used and is still something we're familiar with. So we still consider it part of the language. Other things to note, we in the holistic approach, which integrative really touches upon, that is everything, your entire being, mind, body, spirit is all involved because it's all one. It's essentially all one. And the use of natural approaches is really what our bodies are used to and can take on much easier than any of the synthetic type of approaches or the mechanistic, which involves surgery or irradiating tissue or manipulating things like that, using different tools and instruments that are more modern. Ancient treatments and so forth had different tools which were not so harsh, not so invasive, albeit they did do surgery back in the day, which was a little bit, primitive because
cruder, maybe slightly cruder than what.
Yeah, because of the I think my light went dim. Because of the lack of all of the inventions that we have now. So they were cruder, and so people may or may not have survived a single procedure. So, given that there are things that can infect tissue and so forth, so sterilization and all that, which we are now in the modern era very familiar with, that helped with preventing, somewhat quick death. So get back to integrative, as I've learned and brought it into practice, I'm using tools that are really fundamental to healing.
Yes,
and
yes.
We can use these different tools in this type of, in this type of a setting, and I could work with hands-on, hands-off. There's also energy work, which is a form of Reiki that I do, nutritional teachings and so forth, structuring diets, and it's just a litany of things that we've learned. So I can't cover every single one, but I just give you a general overview that we use different tools that many are just natural tools. Natural meaning
Exactly.
they're not
with
synthesized.
Precisely, with less side effects, with less toxicity, and you also are a certified naturopath in naturopathic therapies, which I read out the litany of your diplomas. But the point I wanted to make is that the standard conventional certification board, American Board of medical specialties. I think it's called ABMS. Now, what ABOIM does is it's not trying to say that, the conventional ABMS is not valid. It's only saying that, look, there are all these other things that we can do to help the person heal themselves. And I think it's a fairly rigorous, I think, training. And I believe it's for 2 years, you were telling me, I remember, and you had
Yes,
several visits, right, to the University of Arizona.
yes,
And I think the Weil Center is the pioneering, isn't it the pioneering center?
yes. And it does involve, or it did involve for me, having completed that course, in doing immersion weeks where I would go for a week here, a week there. I would have to go and engage kind of intensely. And we also were doing these Zoom meetings. I would have a group of doctors. We'd all get together with our instructor and or mentor, who could be a specialist, one or another, and we'd go over things. I would take exams really all the time, just taking regular quizzes and other exams after every subject, and I was subject to that and deadlines, and I had to do it in the whole mix of what I am doing, and that is I'm trying to conduct my own practice where I see patients daily, and so I would have to take the time to do that, and after hours it was just a lot. And family life, I had to basically balance it all, and but it was okay. It was worth it. It is worth it, and I never stop. I really continue the education process.
Exactly. That's what I was trying to say, that it's a continuing journey of equipping yourself to be the best possible healer, because that is your vocation and your forte. And readers, I made a small mistake. It's not Sloan Kettering, but I think Mount Sinai, where you had your residency after the
Correct.
New York College of Medicine. And I want to come back to your learning process in our next episode, especially how in your own journey, look how you've started moving beyond, as it were, out of the box, beyond the very conventional biomedical interventionist, the pharmacopoeia, etc., into a more holistic and integrative approach to healing. So that's what we'll talk about in our next episode. But I only wanted to say once again, congratulations. And it's really wonderful that, Welcome Home, which is your dream, your baby, Welcome Home Center for Integral Healing and Learning and Education, right here in Spring Hill. I've added one more thing to the actual official title, but it is a center for healing, as we know. And I invite, both the serious and the curious to come and visit and see, what this wonderful center is like. So, with these words, thank you, Dr. Maria. And viewers, do like, share, and subscribe to our channel. Learn from us, but this is not medical advice, so do consult your own doctor before you make any changes. And hope to see you soon in our next episode of Be Consciously Healthy with Dr. Maria. Thank you.
Thank you.